The Nigeria Medical Association wants the health authorities to reverse the decision to suspend residency training programs for striking doctors. It also demands unconditional reinstatement of resident doctors that have been handed sack letters. This was the outcome of an emergency meeting of NMA's national officers in Abuja.
This is the circular that forced the NMA to have an interface with the media on the ongoing doctor strike. And expectedly, its leaders are not impressed by a decision they say is targeted at breaking their ranks. Rising from an emergency meeting, NMA is demanding an immediate withdrawal of the suspension circular.
Consequently, it is hereby resolved as follows. 1. Nigerian Medical Association condemns in totality the alleged presidential directive via the Federal Ministry of Health suspending residency training program in Nigeria. Nigerian Medical Association demands immediate withdrawal of the suspension circular and unconditional reinstatement of the so-called SAG resident doctors. Government should show commitment on her part in resolving the current impasse with the Nigerian Medical Association. By all means, any attempt by government to break her ranks as association will be resisted. Rather than abolishing residency training program, government should show more commitment towards improving the already poor-funded program.
NMA insists that the decision to abolish residency training program is illegal. It also sent out a clear message to resident doctors.
In the light of the above, therefore, the Nigerian Medical Association hereby directs that no doctor should accept or collect any sack letter or sign any register opened by the government or her agents in the hospitals. For the avoidance of doubt, no medical doctor, no matter how hungry, should pick up any locum appointment with the government hospitals as directed by the circular. Any doctor who flouts this directive does so at his or her own peril.
The government had argued that the doctor strike was not justifiable since it had met 90% of their demands. But the doctors have a different position.
And on the 24-point demands, government said yes, yes, yes. That does not mean implementation. And what has been said by the Honorable Minister that 90% have been met, it is absolutely false. When we expect that an agreement has been implemented is when the end result has been achieved.
The striking doctors say they have no intention to return to work until all their demands are met. They say government's decision to suspend residency training would only make a bad situation worse.